Bell's palsy is an acute condition characterized by the sudden onset of unilateral facial paralysis due to dysfunction of the facial nerve, or cranial nerve 7. The facial nerve controls the muscles of facial expression. As shown here, it branches out to the muscles of the forehead, eyes, and mouth. In Bell's palsy, inflammation or swelling of this nerve, often linked to viral infections like herpes simplex, can cause compression within the facial canal. The exact cause remains unclear, but viral infections are often implicated, with the herpes simplex virus being a common suspect. When inflammation occurs within the narrow bony canal the nerve passes through, it can lead to ischemia and nerve damage, causing paralysis on the affected side of the face. Here is an MRI image showing inflammation of the facial nerve. The arrows highlight areas where the nerve appears swollen, indicating compression in the facial canal. This pressure disrupts the nerve's ability to send signals to the facial muscles, resulting in paralysis. Patients with Bell's palsy usually present with a sudden onset of facial weakness. The paralysis typically peaks within 48 hours and is confined to one side of the face. Symptoms include the inability to close the eye, drooping of the mouth, and loss of the nasolabial fold. Some may also experience altered taste or increased sensitivity to sound on the affected side. Diagnosis is clinical, based on the sudden onset of unilateral facial paralysis. However, it's crucial to rule out other causes such as stroke or Ramsay-Hunt syndrome. Imaging, like an MRI, is only recommended if there are atypical features or if the paralysis is progressive or bilateral. This MRI scan demonstrates a classic case of Bell's palsy, with clear swelling of the facial nerve marked by the arrow. This type of imaging can be useful for excluding other conditions, but it's not typically necessary for standard cases. The cornerstone of treatment is corticosteroids, which should be started within 72 hours of symptom onset. Antiviral therapy may be added, though its benefits are less clear. Eye care is critical for patients who cannot close their eye. Protective measures like lubricating drops and taping the eye shut at night are essential to prevent corneal damage. Most patients recover fully within 3 to 6 months, especially if treatment is initiated early. However, older patients and those with complete paralysis may have a poorer prognosis. Some residual effects, such as facial asymmetry or synkinesis, may persist. In conclusion, Bell's palsy is a treatable condition, and early intervention with corticosteroids improves recovery rates. Understanding its pathophysiology and presentation allows for prompt diagnosis and management.